Have you ever been to the doctor, let's say a chronic knee pain, or let's say a high blood sugar reading, and the doctor just hears your symptom and they say this is the pill that you take to help with your symptom, or this is the injection that I'm going to offer to help with your symptom, and that's it, they move on. When the numbers start looking good, or let us say the pain gets slightly better, they say you're fixed and to only come back as needed. This is exactly how we treat a broken machine. But deep down, you may not be feeling better. You might be constantly worried that the knee pain might come back, or you may not be feeling confident while doing a certain movement. Or your tiredness might be ongoing even though your blood sugars are back to normal. Unfortunately, the medical system trains us to become technicians, and that includes me as well. We are constantly worried about what box should I put a particular patient in. So for example, in the case of knee pain, I'm worried about what the knee pain is due to so that I can put the patient in that box and start treating that box. Or let us say, in the case of elevated blood sugar, I'm trying to decide which box should I put this patient in, basically what caused the diabetes, so that I can start treating that box. While these labels are a necessary part of a treatment plan, the problem is that once we label you, the treatment starts to become more like a menu card. You choose an option, or some doctors don't even ask. They just write a prescription and they start moving on. I'm Dr. Sri, and in this video, I'm going to talk about why I chose to become board certified in integrative medicine in spite of being a board certified family medicine and sports medicine doctor. So my journey started a long time ago. I spent a lot of time with my grandmother, and she was the doctor of the house even though she wasn't medically trained. She had prescription for every illness. For example, if I have a sore throat or a common cold, she would have an herbal decoction ready. Let's say if I have an injury, she'll make an herbal ointment from scratch and apply it over the wound. Even the diet keeps changing depending on what illness we might have. For example, there might be weeks where there might be too much of coconut water just to improve one's hydration. Or let's say an adult has a kidney stone, she would be cooking a lot of banana stem to help with the kidney stones. Again, I'm not here to discuss whether all these practices were evidence-based or not. We can also accept that modern medical system isn't perfect either. We do overprescribe a lot of times even for the simplest things. I eventually came to the US to pursue my sports medicine degree. I came here, did masters in exercise physiology, then I did family medicine residency, then I did sports medicine fellowship. And then I started my career as a faculty physician at the University of Kentucky, and also I was serving as a team physician for a prestigious college here. But even with all that training, even being able to prescribe exercise and nutrition, I still couldn't put every patient into a box. And I saw other providers referring them away to a different provider, or they might start adding more and more medications to the point that we don't even know that a new symptom is because of the medication or because of a new illness. Right then, I knew that I didn't want to become a technician for the rest of my life. I wanted to be a healer. Now let us look at the difference. So imagine you have knee pain. A technician sees the knee pain as an independent part. So they're going to ask what your pain level is, and let us say if your pain level is 7, and let us say if they can bring the pain level of 7 to all the way to 2, they have succeeded. But a healer knows that a patient does not walk into the clinic just with pain alone. They walk with suffering. So there is a formula that I learned during integrative medicine fellowship. So suffering is equal to pain into resistance. If I have pain, and that pain prevents me from playing basketball, and I hate that the pain exists, that isn't just a physical sensation, that is suffering. Now let us look through a different lens perspective. So we'll take an example of a tree and branch analogy. So a technician is focused primarily on the broken branch. They do not see the health of the tree. Whereas a healer looks the whole tree and the branch together. So let us say in the case of knee pain, which is the broken branch here, I'm focused on dialing down the pain, but I don't care about the health of the tree. But we know that if the health of the tree is not well, that broken branch is not going to be fixed forever. A healer is going to not only focus on the broken branch, but is also going to focus on the health of the tree as well. For example, we talked about suffering is equal to pain into resistance. And that resistance could be resistance to healing, or it could be a mental resistance so the patient is not able to accept the fact that something exists. But if I'm just only going to focus on the pain, And then if I get rid of the pain and the pain comes back, the suffering comes back as well. So that's why a healer is going to focus on the entire health of the tree and not just the branch alone. For one person, pain is just something that happens in life. For another, they're terrified because the entire identity is tied to their physical ability. They might be in a state of depression and the pain is just a final added stressor. I see this in lab reports as well. For example, I'll see a patient who's pretty happy, healthy, exercising regularly, eating healthy, but then I would see some random red numbers on the lab reports. Whereas I've seen many number of patients where their entire diet is unhealthy, they do not exercise, they are sedentary, but still their lab reports will look perfectly fine. We have to understand that true health isn't just green numbers on a lab report. It is a state of well-being. My job isn't just to fix the branch, it is to look at the entire tree. So how do I assess the whole tree? A technician asks, what's the matter? A healer asks, what matters to you? So whenever I see a patient, I look for these three things: meaning, aspiration, and purpose. And these three things are relevant at every clinic visit. So take that patient who can't play with their grandkids because of the knee. Their meaning is family. Their aspiration is to be an active grandparent. The purpose is to bring joy to those kids. So suddenly, our goal is not to reduce pain by 20%. Our goal in this case is to help this grandmother to be active with their kids, and even if there is a slight discomfort, they're able to pursue their meaning. So whether you're a grandmother or a college athlete, the goal is always deeper than the symptom. So how did the fellowship help me? So being an integrative medicine physician means that I've got a bigger toolkit. I still practice bread and butter medicine where I prescribe medications, but the focus is not just a symptom alone. The focus is whole health. I don't stop at the prescription. It's about being a healthcare partner. I tie tools to the specific patient. For example, for one patient, we might talk about yoga, whereas for another person, yoga may not be a good fit. We might be talking about high-intense interval training. One might need meditation to help with their anxiety or even their pain, whereas for another person, it might be a gluten-free diet, even though they may not have celiac disease. For one person, I might suggest a turmeric supplement, whereas for another person, I might suggest a valerian root supplement, even though they both have arthritis and an X-ray. But the most powerful tool that I have is listening. I've had so many patients tell me that you're the first doctor who have listened deeply to my complaints. We have to understand as physicians that words can heal and words can harm as well. You cannot imagine how many patients that I've seen have told me that their doctor said that they've got a 70-year-old back, which is why their back hurts, or their knee pain is due to the fact that their knee is grinding on each other, which is causing the pain. As we say these things to a patient, do we think it is helping the patient, or are we just adding more to that suffering? My goal is to help you navigate healing, not just prescribe a pill and walk away. Integrative medicine taught me that healing doesn't always mean a new knee or losing certain number of pounds on a scale or seeing those green highlights in the lab reports. Sometimes healing just means finding peace and contentment within one's life while we work on the physical. So in a future video, I'll dive deeper into one of my favorite medical tools, medical acupuncture, and how it bridges the gap between ancient wisdom and modern science. I'll share specifically why I started that journey as well. Okay? I hope this video was helpful. If you have any questions or comments, please post in the comment box below. And I'll see you in the next video. Until then, goodbye.